The driver for Paper-Lite was that we're building a new hospital and we really had a view to the future, and we wanted to build a hospital for the years ahead.
I think the greatest feature has been just the accessibility from each department anywhere in the hospital. I could even read a psychiatry note or a note written even in an outpatient department while I'm in theatres, and I think that's been the greatest feature of it all, and I think a lot of emphasis should be placed on that, because for us time is everything, and if we can save time, especially being busy registrars, I think we should really jump on board with this idea, because it's really saved me a lot of time and energy just running around the hospital trying to find things, so it's been fantastic.
You don't have to wait for files, you can be anywhere in the hospital and looking at the patient files.
Continuous docs is one of the key features of our implementation of Paper-Lite.
You don't have to individually click on everyone's entries. It's just continuous data collection on the patient over the last 24 hours or 48 hours or even longer.
You can move up and down in it very quickly. It has a very powerful search function that allows you to search for a particular author, a particular specialty, a particular date range, or certain keywords. You can pull up those records instantaneously and go through the record very efficiently.
As Between the Flag is online now, so on admission and during the handover, it is discussed as a part of the clinical handover, and it's seen by all the nursing staff.
When you're having, say, a bedside handover, you just click on those buttons and all the information are there available for you. Whereas before, the clinical handover would take more than, say, 20-30 minutes just to verbalise and say what is important.
When we schedule emergency cases, we would fill out a green sheet. There were a lot of those on a clipboard. Now we can go anywhere on the intranet within the hospital and look at the schedule as a web page, and that will show all the pending emergency cases for the hospital.
Now referrals are much more streamlined. They just go straight into the computer system and they go straight through as a text page to your pager, and you get a list every morning and you're able to see, oh, these are all the people that I need to see. It's much more, less time consuming that way.
After our initial going live with the first surgical ward in July, we had other wards saying, when can we go? We want to go next. The enthusiasm around the place for it was palpable. It was really a very exciting time.
And what this did was it strengthened partnerships with health infrastructure, e-health, our IT department within Western Sydney Local Health District, but it also strengthened relationships across departments here at Blacktown Hospital.
It was this collaboration, this determination, enthusiasm, which really, I think, were the keys to the success.